When a child is deprived of quality sleep, it diminishes most facets of their development. Dr. Marco Sampoli is a pediatric pulmonologist with a special interest in pediatric sleep medicine and child sleep studies.
Sleep studies in children is a fairly new phenomenon, and it's really arisen because of increased recognition of breathing problems that occur only during sleep. In children, it's more common in adults, but children also suffer from breathing problems like obstructive sleep apnea or very shallow breathing during sleep. The two main reasons we do sleep studies in children is, first of all, children who have really bad snoring that can cause them difficulty with breathing at night, and it can cause very disrupted sleeping. And the other main reason we do sleep studies is children who have or born with medical conditions which predispose them to having ineffective or poor breathing during sleep.
Sleep studies are used to investigate excessive daytime sleepiness, snoring, breathing patterns, and unexplained nighttime wakings, among other disturbances.
Basically what it is monitoring the physiological patterns in a child's body while they sleep. And that includes how fast they breathe, how shallow they breathe, how regularly they breathe, what happens with their heartbeat during sleep. It also measures certain brain waves. There are different stages of sleep. You have light sleep, deep sleep, and breathing problems can occur at very specific stages of sleep. So we monitor a whole lot of things, and at the end of it you put it all together and interpret exactly what it is.
The technology used for pediatric sleep studies is very similar to that used in adult sleep studies and can be used to identify common problems like sleep apnea.
Christine came to us. She was born with a muscle condition which basically results in her muscles being weak, and she complained of really disturbed sleep. She wasn't sleeping well at all. She was waking a lot during the night. She couldn't concentrate during the day, and it was affecting her school. We suspected there may be problems with her breathing because of her underlying problem. And when she had a sleep study, what we noticed is during sleep her oxygen levels dropped remarkably and she would wake up. Through the Breathe Easy program, which is a program we're running here, supplied her with a ventilator, which is a machine which she attaches on her face and her mouth and helps her breathe. And her life has changed dramatically since this problem was recognized. The machine basically breathes for her when she can't. And because of this, she can have good quality sleep.
Conditions that could trigger sleep disturbances include anxiety disorders, reflux disease, ADHD, and muscular dystrophy, as in Christine's case. Her mother, Juanita Berger, shares her story.
Christine was born with muscle dystrophy. Christine actually didn't sleep at all in the night. I was awake about 5-6 times in the night, so she was very tired. And Dr. Zamboli suggested we did a sleep study with her, and they realized that her lungs didn't have function to breathe in and breathe out. She only had 25% of lung function, and they decided to put her on a ventilator. They call it a BiPAP. So she needs to sleep with the BiPAP every time when she goes to bed or in the afternoons, and yeah, so it's much better after that. We realized that this is not a short-term solution, but she will need to sleep with this for the rest of her life. But the positive side of this BiPAP is that Christine can sleep like a normal child, and she's got a normal life like any other child.
Sleep disorders affect your child's ability to get the sleep needed for good growth, development, and overall health. Sometimes problems with sleeping contribute to learning, mood, and behavior troubles during the daytime.
For most children with bad snoring, we can generally cure the problem with an operation and medicines that might control their allergies. However, for some children who are born with underlying medical conditions, the most common are usually muscle conditions, muscle weakness, muscular dystrophies, for which there is no cure. And because of they have to live with this condition the rest of their lives, we generally support. They may need to stay on a breathing machine for the rest of their lives. But the value in that is that their quality of life is vastly improved because they can sleep better, they can breathe better, and thus avoid complications which might have occurred if they didn't have this machine to breathe.